Oh.
Hi, I'm Sarah Doe, and this is NU552 Journal number 2. Thank you for volunteering. Do you agree to participate in this simulated interview and be video recorded for educational purposes? Your personal health information will not be shared or used.
Yes.
Okay, can you state your name and age, please?
Lourdes Hondo, age 18.
Okay. What brings you in today?
I've been feeling fatigued lately and also just my annual checkup.
Okay, I see. Let's talk a little bit more about your feeling tired. When did you first start feeling this way?
About a couple months ago.
Okay. Is it more of a general tired feeling or more like a certain part of your body?
No, it's more generalized.
Okay. And how long does the fatigue last when it happens?
Usually until I go to sleep.
Okay. And can you describe these feelings of fatigue?
I've been feeling tired, less energized, and I can usually push through it and complete my daily tasks.
Okay. Does anything seem to make you feel more tired?
Not getting enough sleep and stress.
Okay. How about when you get enough sleep? Do you still feel tired or do you feel like you're refreshed then?
Sometimes when I don't, or when I get enough sleep, I still feel like tired.
Okay. Okay. Does anything help with the fatigue?
Getting enough sleep, rest, relaxation, but as I said, even if I get enough sleep, sometimes it still doesn't help.
Okay. Do you feel more tired at a certain time of day, and how often do you feel tired?
I feel tired most days, and it's usually like in the late afternoon that I feel most of the effects of my fatigue.
Okay. Is it just a couple days a week, or is it most of the days of the week?
Just most days of the week.
Okay. On a scale of 1 to 10, with 1 being just a little bit tired and 10 is the most tired that you've ever felt, where would you say your level of fatigue is in there?
Most days it's a 5, some days it's a 6. I can still push through though and finish my daily activities.
Okay. Have you noticed anything else since you began feeling tired, like dizziness, chest pain, shortness of breath, snoring, trouble sleeping, stress, or weight changes?
I've had stress at work. So I sometimes have trouble sleeping, and I have had weight gain.
Okay. How much weight have you gained and over like what kind of time span?
I'd say like 7 pounds over the past 2 months.
Okay. Have you been eating more than usual, do you think?
No.
No? Okay. How many hours of sleep do you usually get every night?
7 to 8, unless I'm feeling stressed, then it's like 4 to 5.
Okay. So you have a history of high blood pressure and hypothyroidism. How have those been lately? Any issues or changes there?
My high blood pressure has been, I think it's been okay lately. It's usually 120 over 80 or less. Unless I'm stressed, then it can be more. But with my hypothyroidism, obviously I came in for feeling fatigued. I don't know if that's maybe related to that or what it's from.
Okay. And have you been taking all of your medications every day?
Yes, I've been taking everything as prescribed.
Okay. So you're still taking the HCTZ 50 milligrams once a day and the Synthroid brand name 75 micrograms once daily is prescribed?
Yes, the Synthroid has been more expensive, but that makes me feel better, and I've been receiving coupons from the company, which has helped with the cost.
Okay, so you prefer the brand name?
Yes.
Okay. Have you developed any allergies to any medications, food, or environmental factors since we saw you last?
No.
No? Okay. Besides high blood pressure and hypothyroidism, have you developed any other conditions since your last visit?
No.
Do you have any? Have you had any other surgeries besides the cholecystectomy since your last visit?
No.
Have you had a colon cancer screening? And when was your last mammogram?
I have not had a colon cancer screening, and my last mammogram was 2 years ago.
Okay. For family history, we've got that your parents are living and have hypertension, your sister has depression, and both your brother and grandfather have insulin-dependent diabetes. Has anything else changed since your last visit?
My sister developed hypothyroidism like me.
Okay. Let's review your social history. Are you still working in retail sales?
Yes.
Okay. Are you still married and your children still living at home?
Yes.
Do you still drink about 1 to 3 glasses of wine per week and no tobacco or other drug use?
Yes.
Okay. Now I'm going to ask you some questions reviewing different body systems. Have you noticed any fevers, chills, or night sweats?
No.
Any swelling in your legs or ankles, varicose veins, cramps, or color changes in your fingers or toes?
After a long day of work, I'll sometimes have swelling in my legs, but that'll go away once I rest and elevate my legs.
Okay. How about any rashes, itching, changes, or new moles?
No.
Okay. Any changes in your vision, headaches, sore throat, runny nose, stuffy nose, or hearing problems?
I've had headaches. stress from work.
Okay, and how about that sinus, vision, and hearing
Yep, that's
issues?
fine.
They're okay? Alright. Any neck pain, stiffness, or swelling?
No.
Do you have any lumps, masses in your breast, or nipple discharge?
No.
Any chest pain, heart flutters, or skipped beats?
No.
Any shortness of breath, coughing, or wheezing?
No.
Okay. Any nausea, vomiting, diarrhea, constipation, blood in the stool, or abdominal pain?
No.
Any pain with urination, going more frequently, blood in the urine, or problems controlling your urine?
No.
Any changes in your menstrual cycle, hot flashes, or sexual health?
No.
Any joint pain, stiffness, or muscle aches?
No.
Any numbness, tingling, weakness, memory, or concentration issues?
I've had concentration issues when I'm tired.
Okay. Any numbness or weakness?
No.
Okay. Any bruising, bleeding, or swollen lymph nodes?
No.
Any excessive thirst, urinating a lot, hair loss, or feeling hot or cold?
I felt cold lately, and I've noticed more hair loss than usual.
Okay. How long have you been noticing those changes?
They started around the time that I started feeling tired, so a couple months.
Okay. Have you been feeling any anxiety, depression, or mood changes?
I feel anxious whenever I'm stressed.
Okay. How about depression or mood changes?
No.
Okay. All right, well, that wraps up this video, and thank you for participating in this simulated interview.